So this disruption can lead to the diseases such as inflammatory bowel disease. We have different types of dysbiosis. The first one is the loss of the beneficial bacteria. The second one is the overgrowth of potentially pathogenic bacteria. The third is the loss of the overall bacterial diversity. And finally, the overgrowing in an area they are not supposed to be in. It is not a pathogenic bacteria, meaning that it is not infection, but a normal bacteria that has set up home. There is a change on the wrong location of the bacteria in the gastrointestinal tract. So SIBO, what happens when bacteria ends up in wrong place? This diagram illustrating the comparison between the normal distribution of the intestinal bacteria and the patient with a small intestinal bacterial overgrowth. When we are handling with the easy digestible starch, we are going from the ileum to the colon, where the fermentation can occur in the colon. Why? Because we have a very small number, up 10 to the power 4 of microorganisms present in the small intestine. But in cases of SIBO, the number of bacteria increase up to 10 to the power of 9, so leading to the fermentation and the gas production in the small intestine, which can occur already in the colon. So SIBO has been recognized as a medical phenomena for many decades. Also, its definition has been debated. The principal concept is that normal small bowel has very low number of microorganisms compared to the colon, and this normal balance is significantly altered in SIBO. What is SIBO? SIBO, it is a small intestinal bacterial overgrowth. It is type of dysbiosis where an overabundance of bacteria develops in the small intestine. It is not pathogenic bacteria, but instead a normal bacteria that has set up home in the wrong location in the small intestine and instead of the colon. So when to diagnose the SIBO, the number of bacteria must be more than 10 to the power 4 organism. This bacterial overgrowth can be a combination of bad bacteria as well as good bacteria. We have several mechanisms in order to affect patients suffering from SIBO. Number one, several mechanisms help us to maintain how microbial numbers in healthy small intestine. We have a protective mechanism in our small intestine which help us to get rid of these bacteria. Number one is the antimicrobial peptide, particularly immunoglobulins, which are secreted by the small intestinal epithelial cells. Number two, the contraction, the continuous contraction of the small intestine help us to clear the small intestine from the microbes. Number three is the acidity of the chyme which are coming from the stomach. And finally, the ileocecal valve, which prevented the backflow, and so keeping the small intestine near to clear from these bacteria. So, when this mechanism breaking down, abnormal large numbers of microbes bloom in the small intestine, and the types of microbes normally found in the colon colonize on the small intestine. This it will lead to, number one, these microbes ferment food. الموضوع بتاع الفود allergy بتاع الدكتور فتحي. These microbes ferment food in the small intestine, producing hydrogen and other gases. They can also degrade the thin mucus layer, and they come in contact with the gut barrier, causing inflammation and the intestinal permeability, what we call leaky gut, and leading to the sensitivities and the inflammation. SIBO also it leads to the maldigestion and the malabsorption, as the bacteria interfere with the normal enzymatic and the metabolic activity of the small intestine. Additionally, these bacteria are associated with increased serum, endotoxin, and the bacterial compounds, stimulating the production of the inflammatory and the pro-inflammatory cytokines. As a consequence of this, there is a malabsorption of both elements which are absorbed from the ileum, like that of iron, and so patient will be subjected to iron deficiency anemia and the megaloblastic anemia. And this is cartoon representing the pathophysiology of the bacteria, which compete for and steal our food. This overgrowth of the bacterium, it will lead to the fermentation and the gases production, which more and more perpetuate bacterial overgrowth. This action of bacteria with the production of toxins will impair the brush border of the small intestine with deficiency of certain enzymes which is necessary for digestion and absorption of food, and the production of the different gases which lead to the pathology in patients suffering from SIBO. So if you have normal immune system, the bacteria will be rich and balanced communities. But when there is a disturbance occurring in the small intestine, the poor and unbalanced bacteria communities, it will lead to the autoimmunity and the allergy and the metabolic disorders with immune disorder. What about the symptoms of SIBO and the associated diseases which can occur with SIBO patient? About half of patients suffering from SIBO didn't have any gut symptoms, and about 100% of fibromyalgia patients had SIBO. While this diversity of symptoms, according to the number of bacteria and the types of bacteria which colonize the small intestine. So, when we are faced with the case of IPS didn't respond for the treatment of IPS, we must search for SIBO, the same like that of GERD, as well as the intestinal permeability symptom, leaky gut, and the malabsorption, and so associated symptoms. The best example for association of SIBO and other systemic disease is like that of the fibromyalgia. Why? Because bacterial endotoxin and the polysaccharide causes inflammation and the mitochondrial impairment and the associated sensitization of pain, as well as the bacteria produce the D-lactic acid and the hydrogen sulfide. It is considered as the neurotoxin and the metabolic poisons causing fatigue, muscle pain, and discognition. And finally, the bacteria producing tryptophanases, it will lead to the tryptophan deficiency, serotonin deficiency, and the melatonin deficiency, which is typically the pathogenesis of the fibromyalgia, which can occur in patients suffering from SIBO. So we have bad bacteria and the good bacteria. The bad bacteria increases in SIBO patient. It will lead to the fatigue, diarrhea, skin lesions, nausea, vomiting, malnutrition. Also, the good bacteria, it will decrease, leading to the bloating, gas production, abdominal pain, and food intolerance, and weight gain, as well as joint pain. Even the thyroid, it does not escape from patients suffering from SIBO. So we have a lot of diseases associated with SIBO, like that of IPS and acid reflux and the chronic fatigue syndrome. Also, we have risk factors associated with SIBO, like that of low stomach acid. Every now and then we are taking antacids. This antacid, it will lead to the impairment of the gut barrier, as well as a motility disorder and the stress. A lot of factors are associated as a risk factor for SIBO. To sum up, medications that disrupt the gut flora, like that of antibiotics, acid-blocking drugs, and steroid play an important role in the disruption of the gastric microbiota. So, the most common causes of SIBO is a diminished stomach acidity, poor gut motility, intestinal neuropathy, and physical obstruction, as well as diverticulosis. Low stomach acid symptoms, it will lead to belching, bloating, heartburn, gas, undigested food, and acne and anemia. This is considered as one of the causes of SIBO. How to differentiate SIBO from other conditions similar to SIBO? We are depending on the different hydrogen breath test. We have different subtypes of SIBO. If we only find the hydrogen in the breath test is positive, it is the one type. If we have methane, it is a second type, and we have the hydrogen sulfide present in the breath test, and easily can be asked in the laboratory for diagnosis of SIBO by asking about the hydrogen breath test. And these are the different tests which can be used in SIBO patient. Hydrogen breath test, we can use the glucose, the lactose, and the fructose with different sensitivities. Moreover, we can use endoscopy, introducing up to the jejunum or even the ileum, and they take an aspirate for culture, and this is one of the very accurate methods for diagnosis of SIBO patient. Finally, what about the treatment? Here we are depending on the change in the diet habits mainly, and we add an antibiotics for short period, for certain duration, in certain concentration, in order to achieve complete resolution and restoring the normal immune mechanism. Let us to start with the risk factors which we can overcome in patients suffering from SIBO. For example, we can treat SIBO with what we call intermittent fasting. And instead of eating every now and then, we are eating in a short period, about 8 hours, let about 16 hours free from diet. This is a 12 treatment of deficiency of digestive motility, particularly the migrating motor complex, which is very important for cleaning our small intestine. The fasting helps to starve down the bacteria and reduce their count. It also helps to enhance the healing process and restoration of the gut lining, and help in the regulation of the pH. So, one of the essential lines of treatment is the fasting for a long duration. The second is to add HCl instead of decrease the HCl by treatment of Helicobacter pylori, which suppress the HCl production, and the underlying medical condition like the overuse of the PPI and the frequent use of the apple cider vinegar, which help us to restore HCl acidity. And we give the patient anti-anxiety for distress, which help play an important role in SIBO. What about the role of antibiotics? We can use also the rifaximin in cases of patients which are hydrogen producing. If there is methane, we can use neomycin in addition of the rifaximin, and both of them, they are giving us a very excellent result. When you're comparing this antibiotic with the natural antimicrobial, the randomized controlled trials can recommend the use of the natural antimicrobial, which are present in our food, producing the natural probiotics, helping us to clean the gastrointestinal tract, particularly the small intestine, from these bacteria. We have different studies for the use of the antibiotic, and we have the recommendation. The use of antibiotic in symptomatic patient with SIBO, it is very important in order to eradicate the overgrowth. Also, the use of antibiotic has been the consensus of therapy for treatment of SIBO, but don't forget to use the antibiotic for a long time in order to avoid the production of another microbes like that of Clostridium difficile. The first of antibiotics which was used is a tetracycline, but we didn't have enough data about tetracycline. The other antibiotic is the amoxicillin, clavulanic acid, chlorotetracycline, ciprofloxacin, doxycycline, metronidazole, neomycin, and so and so. But the evidence now is going with the combination of neomycin and rifaximin, and this study illustrates that about 87% of subjects treated with both antibiotics for a duration of therapy ranging from 1 week up to 4 weeks in a dose of 500 mg twice daily for neomycin and 400 mg twice daily for 3 times daily for rifaximin, giving a very good result. So the combination of both neomycin and rifaximin give us a very good result. Also, we have a ciprofloxacin and the metronidazole also giving about near to 90% for 1 month duration in patients suffering with SIBO after diagnosis and the documentation of SIBO disease. Don't mess what we call back to nature. It is about 11 most powerful natural antibiotic like that of the apple cider vinegar, الخل والحاجات البسيطة ديت, الgarlic والginger and the onion play an important role in the restoration of the microbiota, which is essential for the balance between the harmful and the bad bacteria. And also the treatment of SIBO, it is need to remove 4 R's, get rid of the things that negatively affect the gastrointestinal tract, like that of infection and the gastric irritant, and replace the good by the proper digestion and absorption, like that certain types of food, and re-inoculate particularly the macrobiota, like that of lactobacillus, play an important role also in the restoration of the immune system. And don't forget to give an adjuvant drug like that of the L-glutamine and the zinc and omega-3, which help in the repair of the intestinal mucosa. So the 4th R, get healing approach, remove the harmful substance and bless by very good and reintroduce the microbiota and give the natural antioxidant for the repair of the intestinal mucosa. And finally, don't forget certain diet like that of the low food map diet. This diet, it is a specific type of carbohydrate that are highly fermentable and stimulate the growth of microbes, must be avoided in order to help in the healing of the mucosa of the small intestine. So what we call the food map diets here are the food map foods to avoid. This is the last 2 slides. Excess fructose, excess lactose, and the fructan and the galactan. This is the avoided. And also, we have what we call the link between the gastrointestinal tract and the brain, what we call GAPS diet, which is the gut psychology syndrome. It is a research work done and now applied for certain diseases, because we have a link between the gastrointestinal tract and healthy individuals and the gut and the brain, and avoid the stress which affecting the gut and so affecting the brain. And this is the approach for GAP diet that avoid nuts and the legumes and so. After giving treatment for the SIBO, it is must to assess if the patient cured or not by antimicrobial and the Sibo diet, and retest for 6 to 8 weeks. If the patient is positive hydrogen breast test, we can repeat the antimicrobial and the diet. If the patient is negative, must to maintain its diet by giving pro-antibiotics. And don't forget that the physical health and the rehydrations and the liquid nutrition help us for keeping our health. And so we recommend that when we are using breast test like hydrogen or lactulose for diagnosis of Sibo on patients with IBS, in order to make sure that these patients suffering from IBS alone or Sibo, also in patients suspected for any gastrointestinal disorder, motility like that of GERD, chronic constipation or diarrhea, or patients subjected before to any abdominal or luminal surgery, we must to ask for Sibo. In patient with testing for methane using glucose and the lactose breast test to diagnose overgrowth of methane producing organism in symptomatic patient. So simply you can ask for this hydrogen breast test in order to verify the nature of our patient, if it is pure Sibo patient or suffering from concomitant disease. And thank you finally.
Thank you for the time is perfect يعني. بس عايزه اقول لحضرتك او اسال حضرتك سؤال، رايك ايه what's your opinion about the abuse of both antibiotic in children and the abuse of BBI in all prescription, medical prescription, anyone going to doctor for any reason they prescribe BBI.
طبعا حضرتك سؤالك يا دكتوره فاطمه جميل جدا، وده كان صلب المحاضره لما الدكتور مجدي كلمني عنها. ففعلا احنا حاليا دلوقتي يمكن بقالنا اكتر من سنه بنتكلم عن الابيوز اوف بي بي اي. الابيوز ات هاز ا بليس ان ذا تريتمنت اوف بيبتيك ألسر ديزيز، بس لازم نمشي تبع الجايد لاينز فروم 4 to 6 up to 8 weeks. لو العيان ما بيستجيبش يبقى لازم تو سيرش فور ذا انذر كوز. فده one of the factors which causing hypoacidity and they break the barrier of the gastrointestinal tract. And so to avoid this, it is must to rely on the very proper diagnosis. Number one. Number two, the use of antibiotics, unlimited use of antibiotics, it is so wrong. For example, we have a viral gastroenteritis. We adjust to our need for rehydration of the patient, and 2 to 3 days the patient will be completely cured. We don't rush for the use of antibiotic because it will alter the immune system of the gastrointestinal tract, which is very important, and there's so multiple diseases which are now speaking about the era of the small intestinal disease.
Any questions? One short question.
Professor Elfattah, all the tests done for Sibo diagnosis is not perfect. Let's say it is not 100% diagnosed Sibo, as you said.
Yes.
So I think in some papers and in some textbook, they advise the therapeutic test as diagnosis of Sibo. What is your opinion?
حضرتك يا دكتور محمد اسالك سؤال مباشر. I am asking a direct question. How many times you ask for a hydrogen breast test in spite of it is present in the lab?
Never.
Okay. I am personally asking for the hydrogen breast test and sulfate breast test in Alexandria several times, and have a lot of patients suffering from this disease. So when are faced with a case of suspected, because it is very similar with IPS and so and so and so, when you are suspecting that, last weeks I saw a patient suffering from polymyalgia and with skin allergy, going to the dermatologist and giving her corticosteroid, and I am treating her since a very long time from IBS. Just I am asking her for to hydrogen breast, it is positive, and I give her 10 days of rifaximin with neomycin. The patient completely relieved from the allergic manifestation as well as the muscle ache. So I recommend the use and ask for these hydrogen breast tests in order to avoid the dilemma of diagnosis of Sibo.
Thank you very much.
Thank you.
And, we come to the conclusion that